Hey guys, it's Hina Sheth here at Rebalance Physical Therapy, and I'm here to talk to you guys who have been either diagnosed with vaginismus or think you might have vaginismus, what it is, why it comes about, and how we might be able to help with the issue that's going on. So vaginismus, to first understand it, is you really need to understand the anatomy of the pelvis. So here is the model of the pelvis, okay? This is your ilium, these are the two bones, and in the front is the pubic bone. In the back is a cobra-looking head bone called the sacrum, and then you have your tailbone up here, and then you have your spine, which is over here. And then your hips actually connect kind of to the side of that pelvis. So you can kind of see how the spine, the pelvis, as well as the hip are all kind of interconnected together. Now underneath that is a group of muscles called your pelvic floor that is attached from your pubic bone, and it goes down and it connects on to the tailbone. And you can kind of see it here on the inside as well. Okay, all that red is the pelvic floor muscles. Now, when these muscles become spasmed or tight, that is basically called vaginismus. It's just the term for it. Tight pelvic floor muscles that are in spasm. Now, when something like this happens, it can cause a whole host of issues, which I'll talk about in a second. But first, I want to talk about why does this come about and why do people get tight pelvic floor muscles? Well, this can happen for a number of different reasons. But one of the big reasons that can contribute to this is changes in the alignment of the pelvis, hip, and the spine. And those changes can happen for a number of different reasons. They could have happened like things in your past, sports injuries, falls on your tailbones, hip injuries, if you've had a back issue that's been going on. That can definitely contribute to changes in your alignment, which can then create tension into the pelvic floor. Now remember, the pelvic floor is just like any other muscle in your body. It can compensate and it can feel like it has to overwork and become tight because it's trying to, kind of play kind of help out, I guess, when something else is not working right. So we call that compensation, and so it can easily compensate and become tight. Some of the other reasons that these muscles can become tight is if you've had any type of chronic inflammatory condition going on. So say if you're someone that has had chronic urinary tract infections in the past, or maybe currently, or chronic yeast infections, or other type of chronic issues that are in and around the bladder, the uterus, or even the gastrointestinal system, okay? And when these muscles become tight, not only are you going to have trouble, trouble with anything coming out, but anything going in. So if you are suffering from vaginismus, most likely one of the bigger symptoms you might be having is pain with intercourse, because if this is too tight, it's hard for something to go in. But other symptoms that can accompany this that maybe you might not realize that could be associated with this is constipation, because again, something can't come out if it's too tight. You might have difficulty urinating. You can have pain with urination. You can have urinary frequency or hesitation. You might also have difficulty with a gynecologic examination. Sometimes you might have a feeling of fullness when you sit, or you might feel like it's uncomfortable to sit for a long period of time. You might also be suffering from maybe low back and hip issues, or even something called sacroiliac joint issues, or maybe you had a pubic bone issue that's also kind of thrown into the mix, or groin pain. The other things that you might be feeling are you still feel like you're having a UTI, or you still might be feeling like you have a yeast infection. So all of these things can kind of contribute to the pelvic floor being tight, and then they also create symptoms from the pelvic floor once they are tight. So now, what do we here do at Rebalance to improve this? Well, our name kind of indicates it, Rebalance. So again, if everything has been kind of out of alignment, and there's certain muscles, and there's a lot of other muscles that we work on the outside to improve the tension in here, to reduce the tension in the pelvic floor, but we balance all of that musculature out along with the joints. And then the second part is we have to reduce the tension in through this musculature by a number of different techniques. And then we have to kind of re-educate these muscles on what to do, because if these muscles if they've been impaired or dysfunctional and they haven't been doing what they've been needing to do for, months or years, however long you've been suffering from this, then just because you've released the tension out of them doesn't necessarily mean that their function automatically comes back. So this is where we have to kind of re-educate the hip, the pelvis, and the spine, and kind of get everything working together again. So if you are thinking that you have vaginismus, or you've been diagnosed and you're looking for treatment, fill out our form and, have a free consultation with us. It's easy enough to do on the phone or in person, and we can kind of tell you if we think we'll tell you how we can help and what we can do, and be a little bit more individual with you based on your history. If you have already gone and had treatment for this and it hasn't been successful, then definitely, come in and have a consultation with us. And we've been doing this, we have over combined 70 years of experience. All of us have been treating this for significant number of years. We take a holistic, hands-on, one-on-one approach, as you can see. We love treating this. This is what we do. And hopefully we'll see you soon, and you'll start, seeing significant improvements with us. So if you have any questions, again, fill out the form, and I hope to talk to you soon. Take care.